Can this indentation in my cheek be fixed? I have an indentation in my cheek and would like to know if this could be fixed. It was caused by an infection, which has all cleared now.
Thank you for your question. You submitted a single photo and stated in your question that you have an indentation in your cheek after the resolution of an infection, and you want to know if that indentation can be treated. Well, I can certainly give you some guidance on how I approach patients like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and dealing with all kinds of facial infections and issues with rehabilitation has been a significant part of my practice for a variety of areas of specialty which I practice. So, to begin with, when we talk about this indentation, we have to essentially analyze what is the cause of the indentation. And when we look at the anatomy of that particular area in the mid-cheek area, you're looking at, of course, the skin. You're looking at below the skin, the fatty tissue below the skin. And chances are, after that, because of this infection, there was a loss of volume. At a more superficial level, if you could think of a problem such as cystic acne, there is loss of tissue which results in indentation, such as acne scars. In your situation, there's a loss of fat and soft tissue underneath the skin. What also makes this particular area a challenge to correct is that there is nothing to push against when you're talking about adding volume. And what do I mean by that? Well, let's say you had an indentation over the cheekbone. Well, there's a bone underneath, so if you wanted to put a filler, you can actually push against that bone. So when we do something like structural volumizing, we're placing filler on top of bone, and it accentuates the bone structure. When we're talking about the area of this mid-cheek area, without the benefit of physical exam, it's a little bit difficult to say exactly, but chances are there's some scarring and there's some adhesions underneath that depression. So I think that your choices are basically fall into two categories: injectable fillers that can be performed in an office setting with some release of the underlying scar tissue, and then the other option is something such as fat grafting, which would be harvesting fat from one area of your body and placing it into this area. Now, I think that we have to always understand that when we're talking about correction in this area, in an area like this, you have to look more in terms of general improvement instead of thinking of 100% correction. And the reason is that if you put an injectable filler in this area, regardless of the relative thickness of the filler, whether it's something like as thick as Juvederm Voluma, which is currently one of the more thicker hyaluronic acid fillers, or a filler like Radiesse, you have to think about how much volume filler you can place before that filler starts to spread out, or before it pushes and you're not getting the full correction. So a lot of times I tell my patients that even when we're doing injectable fillers, it's a process where we might be able to build upon the effect as time goes on. Injectable fillers, by nature, do stimulate some degree of local collagen production. And there is variability in terms of what an individual patient can generate. It's kind of like muscle building. You know, everyone can stimulate an area of muscle by lifting, but different amounts of muscle growth occurs. So so understanding that, we also have to then think about the more so-called permanent solutions, such as fat grafting. The attraction to fat grafting is that you are literally replacing the tissue that's lost with tissue that is more native to that area. And what are the downsides? Well, like I said, when an area has had infection, and scarring, the vascularity is not going to be the same as it was prior to the infection. So in my practice, I have actually prepared tissue that I want to do a grafting procedure using something like PRP or platelet-rich plasma, or PRP with acellular matrix. Acellular matrix is a wound healing technology that has really made a difference in my practice in helping rehabilitate skin that has been either traumatized from a trauma like a motor vehicle accident to traumas from surgery as well as infection. And it just so happens to be this, what I feel is the next phase of medical progress is in regenerative medicine. So I'll actually prepare a tissue before I would do some kind of grafting. So that being said, I think what you should do is find a physician, a surgeon. I would say I lean towards surgeons because surgeons can do both injectable fillers and the surgery such as liposuction and fat grafting. And I would say that just try to feel your way through what is acceptable benefit and risks that you're willing to take. I think that you have to also understand that regardless of the procedure, it's not going to be likely to be a single point correction. It's going to be something that will require some work and some follow-up and repeat treatments. So, like I said, I think do some research, find a doctor that you would feel comfortable with, learn about your options, learn about what the treatment plan would be, and then pursue the correction of this issue. So I hope that was helpful. I wish you the best of luck. Thank you for your question.